This is the
BrigherSpectrum podcast,
where we illuminate the world of parenting children with autism. I'm CJ, a proud dad to a wonderful 6-year-old with autism. Through my journey, I've discovered the challenges, triumphs, and unique experiences that come with raising a child on the spectrum. Inspired by those experiences, I created this space where parents like you can find understanding, share stories, and learn from each other. Join me as we explore insights, strategies, and support, all while celebrating the brighter spectrum of our children's lives. Now, let's dive in and cast light on this path together. Speech therapy is one of the things that, as parents of kids on the spectrum, almost all of us are involved in on some level, as speech delays are one of the most common sort of situations that we deal with when having kids on the spectrum. And joining me today from Krapf Speech Services is Kristen, owner and speech therapist of the clinic, where she's going to join us and talk to us about speech therapy and her own journey as she's currently pursuing an evaluation for her own child. Kristen, thank you so much for sitting down and having this conversation with me today.
Yeah, I'm glad to be here.
Yeah, it's great. So I've actually had a couple of people reach out and ask if I knew some stuff about speech therapy. So kind of lining this interview up with you is kind of fortunate. It says, honestly, I don't know tons about it myself. My son is in speech therapy through the public school that he goes to. And it's honestly, it's done absolute wonders for him. He was basically nonverbal when he started kindergarten last year. And by the time he started school this year, I can have little conversations with him. And at least like we understand each other to a point. So I'm actually really excited to talk about this with you.
Yeah, definitely. And I think speech therapy gives kids a huge jump in that communication. And I think it's really just, we really want to have those conversations with our kids.
Yeah.
That's always like the little part that's missing with my son. We don't really have a back and forth conversation yet. And it's kind of a struggle. So I'm glad to see both sides of it and hopefully help some families in that respect, and also my son.
Yeah, definitely. Because like you said, as parents, it's like you look at your kid and like, you're like, the one thing I just want to talk to you, dude. Like that's all I want is just to talk to you. And it's hard. And then like especially when it comes to like wants and needs and they can't communicate, and then there's meltdowns and you have no idea, so you're starting to melt down because you have no idea what this kid needs. So honestly, speech therapy really is like paramount for most of us with kids on the spectrum. It seems to be, on at least on some level, they all benefit from it.
Yeah, I think anyone can really benefit from it. I know kids don't always qualify depending on what setting, but it never hurts to go get an evaluation. And I think we can talk a little bit more about that later.
Hmm.
Just knowing how it was hard to pursue that for my son. There were some steps that I had to go through from that side of things that were a little tricky, and you have to advocate for yourself to get those services.
Yeah.
But, there's no harm in it, and early intervention is free. So I always say to just go for it. Tell your pediatrician to give you that referral for speech if you feel it in your gut, and go from there, because the earlier the better.
100% agree. And speaking of earlier, you mentioned to me in their pre-conversation that your child is 2 years old, and you're already in the process of maybe pursuing an evaluation. So before we really get into speech therapy and what you do and how we can advocate for our kids, let's kind of hear a little bit about yours and where you're at.
Sure. So, around as a mom, it gets a little, you know, frustrating, um, especially, in the beginning when he was about 3 months old. Um, like, I knew all the milestones as a speech therapist, so I was really watching to see when he would gain those. And I know it's always like tentatively around this time, but um, I always made me a little anxious. And around 3 months old is when they first start to smile. Um, and I noticed that he wasn't doing that with me. I was getting like no satisfaction from, interacting with my son. Like he kind of just would like stare off into space, and then as he got a little bit older, he wasn't babbling. Um, so they start with that ba ba ba, like, and
Hmm.
then they move on to the canonical babbling where they add different syllables like ba da 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 ba da da. He never really did that. The closest he got to that was like an R sound, which is, as a speech therapist, like that's a really hard sound to get. We don't even look for kids to actually have that sound till 7. That's when they'll pick them up for speech therapy. And he's going rah, 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 rah. And he did that for a little bit and then regressed and didn't do it anymore. But he would do a lot of screeching and screaming. So I would bring it up to his pediatrician all the time. And it was really frustrating because they weren't really listening to me. And it was even hard to advocate as a speech therapist myself. So I would just be like, okay, I'll just wait and see. Go ahead.
I would say that seems to be like a lot of times the case with pediatricians. It's like they don't want to investigate it early and give you those referrals when you need them. Um, they always want to like just keep going forward. It's like, well, man, kids too. There should be a couple of words, but
Yeah.
yeah.
And
So
I
I,
guess there's
it's
some
crazy.
some evidence to back that up that, most kids will come along in their own time. However, sorry.
No, it's fine.
I'm in Allentown. Are you going to edit some stuff out?
Oh yeah,
Okay. So, I guess like they'll come along in their own time, but at a certain point it's going to be that small percentage of kids that don't come along, but now they're delayed and they're behind and they don't have that time to catch up. So that's why I was super concerned um, when they weren't giving me that referral. And even at the 12-month appointment, they weren't giving me that referral.
mm,
They were like, oh, let it come along. I was like, well, he's not saying mama. He's not saying dada. He says some random words inconsistently. Um, and I think if you tell them, oh, yeah, he has more than 5 words, which is what they want at 12 months, at least 1 word to 5 words. Um, I think telling them the consistency of how much they're using the words and babbling, and having a back and forth, word babbling conversation with you is important, because if they're not having that back and forth at all, they're not responding to their name. He wasn't. They're not saying mama and dada, which are the 2 key people in his life that he would, need to request us to be there for him if he needed something. Um, I think there's definitely something wrong if he doesn't have those things. So around 15 months, I decided to just shoot them an email or the message on the portal. And I was like, please just give me a referral because I'm going insane here. He's not doing anything. It's 15 months. He's not responding to his name. I need to get going on this. There's wait lists, you
yeah,
know?
yeah.
And
Oh, are
that's
there
when he
wait
got
lists?
into, yeah, that's when he got into speech therapy. Thank goodness he got into early intervention.
Yeah, and those wait lists are absolute no joke.
Oh, yeah.
They're awful. I mean, it's a couple of months for this and a couple of months for that. And when my son had his evaluation, that appointment was an entire year out after the application process, which took several months.
Yeah, I think ours was about 18 months, and I think it's even further out at this point. So that's why I always recommend, just get on the wait list. And I said that to myself. I'm like, just get on the wait list. If he doesn't need it down the road, if he does come along with his speech therapy, I can always cancel it and like open it up for someone else. But I just got on the wait list for that, and that actually early intervention happened pretty quickly, but then the developmental pediatrician was a really long wait list.
Yeah.
um, but he got speech therapy pretty quickly. I think it was within 3 months he had an evaluation and had an educational diagnosis of a communication delay. Um, so that was the easiest part of the process, and at least he was getting speech therapy in the meantime while we waited to get a medical diagnosis of at least a communication delay so we could
Mhm.
get more services. Um, and that happened in July. So after he was 18 months old when we were put on the wait list, I think, and he was like 2.5 almost when we went to the developmental pediatrician for the first time and got that medical diagnosis of communication delay.
Yeah, and so he's actively in speech therapy now at this point?
Yeah, he's been since 18 months, and actually today we miraculously got into St. Luke's for their outpatient therapy. First, it
Oh,
was
wow.
OT. OT opened. It was like an early morning slot, but we thankfully had the flexibility. It was originally OT, and then they called me last week and said, "Oh, speech opened up. They can co-treat." So they worked together to give him OT and speech at the same time, and he
That's
loved
really
it.
nice.
So we had our first session of that today, and he talked so much, and I was really impressed because I've actually never heard him talk that much. So it was really cool.
They are really good at drawing it out of them. Like, you just and sometimes, like, you sit there and you're like, "I've tried so hard. What are you doing that I wasn't?" And I don't know. I don't know what it is that they do because I've only seen like a handful of the exercises. My kid is a mostly private session at public school. It's part of his IEP. Um, so I'm not really 100% on what exactly they do at all times. But I'll tell you what, it's amazing. It's absolutely amazing.
And parents definitely should not feel bad because I'm a speech therapist and he doesn't listen to me. So I do all the little tips and tricks that I know that I get other kids talking, but he won't do it for me because I'm his mom and he feels comfortable with me. And um, I think sometimes adding that extra person into the mix can definitely help. So, um, yeah, I would never attempt to give him speech therapy by myself because he just won't listen to me. I think it's just a parent kid thing. And I don't think it's fair to have to be his therapist instead of his mom or even try to separate those two hats. Um, I just do the carryover. And I think that's really important to recognize because I think sometimes like we get so frustrated and then you go into the session and like, oh, they're talking for you. They just said a 3-word phrase. And for me, he'll barely tell me that he wants to eat something to say the word eat. So, yeah, it was a little eye opening today. I mean, he knows his speech therapist from EI, but it was really cool to see him interact with some new therapists and kind of take off.
It is really nice. And I mean, maybe because you're his mom, he seems to think that you need to read his mind and can.
And I can in some respect. I think we know our kids so well that sometimes, and I'm guilty of it, I just know what he wants. And so I get it for him and I don't make him work for it at all. Um,
Yeah. Yeah, I think we all do that on some level. It's like they each develop their own little individual ASD language, and we learn that language just out of like necessity, right? Like we're so desperate to communicate with them that we just bend to their language and the way they communicate, and we learn it. And then when they're doing it with somebody else, and this person, is looking like they're looking at a polka dot elephant in the middle of the living room, you're like, oh no, he just wants this, 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 and this, and they're like, how do you what?
I did that in the therapy session today. He was saying the word little, and it's definitely not little. Um, but I only knew it because I know what songs he sings, and he kind of scripts a little bit. So he does say like a lot of song lyrics. He does have some spontaneous speech, but I was like, I knew exactly what he was saying. He was applying it to the game they were playing, and I said, "Oh, he said little," and they were like, they looked at me, um, like I had 3 heads. They're like, "That didn't sound like little." I was like, "Believe me, it's little."
Does he have any words like they're like really like benign words, but they come out and they sound like cuss words when he does it?
Yeah,
They all have at least one.
yes. And he has some like speech sound stuff going on too. Like he definitely can't pronounce some sounds. So even like some typically developing kids have that happen. But yeah, I noticed that definitely happens with him. My nephew, it's so funny because he's 6 months younger than Wayne, my son. And he talks up a storm. He's like speaking in full sentences, and he's like the clearest speech. And then Wayne says like one thing, and it's just sometimes it does sound like that, and you're like, whoa, what did he say? I was like, no, he didn't say that.
It's kind of funny, too, like when you have another kid around, especially when they're younger, because those neurotypical kids, they really like once they do figure out speech, they really don't shut up, and everything's why, and you end up looking at like your sister or brother or friend or whoever's in the room, and you're like, why do they talk so much?
And I think sometimes I've had people say that to me. They're like, "Well, once he starts talking, he won't shut up." And I'm like, "I want him to not shut up though, cuz I like from the speech side of it, I'm so worried about like the foundation for academics, and um I want him to be able to talk and communicate. He's super smart. Like he's got that going for him. He's reading, which
Hmm.
is another thing contributing to the possible ASD diagnosis. He's hyperlexic. He knows about 60 words. Um, and but I just really want him to have that foundation and want him to talk. So when they're like, "Oh, my kid's being so loud and he just won't be quiet," I'm like, "Please, like I want that to happen to me." Maybe not in the moment afterward, but it's like the little things um, that you miss and you really want. I'd be so grateful just to have that.
It is nice. I would say it's nice to a point. Like I wanted it so bad, and like I'm grateful that my son is able to speak at this point as much as he does, and a lot of things aren't real clear, and we have to have like little follow-up questions or little prompts or something to really figure out what he's saying. um but when he's interacting like in like a social setting, it's not, he doesn't really talk a bunch. His most of his talking is gamer rage. He gets on the Xbox and um somebody kills him or something, and he just starts yelling.
I love that though. That's very age appropriate.
Yeah. Yeah.
I love
I
that.
well, like, I let him on little stuff like Fortnite, nothing too graphic. And yeah, he loves it. Or he's real big in the driving games, and like I don't know, he'll fall off Rainbow Road or something. I don't permit him to use a headset, mostly because it lets me hear if other people, like if he gets in like a lobby with people, if they're saying inappropriate things, I can run over and like mute them. Um,
Yeah.
I'm pretty like I don't really leave him alone, right? Like I'm pretty observant, like when he's doing stuff, because they're kids and they'll do stuff they're not supposed to. So,
Oh yeah. Yeah.
um,
I get
but
that.
I guess I had missed one or something at some point, because he called somebody the D word at the top of his lungs, and as a parent, it's like it's everything in you to not laugh, because it's
Mhm.
so funny. It's so funny. But like if you laugh, it'll reinforce it, and then they'll
Exactly.
do it everywhere. So you're like, I need to walk out of this room and find a pillow for a moment.
Yep. I
And
need
when
to
I
be,
get
and then I have to come back and put my parent pants on and and do what I need to do.
right, right. And then at the same time though, it's like I don't want to yell at them for talking.
Exactly. I know that's a conundrum, people run into a lot. You just really want them to say anything, and like, especially when they didn't talk for so long, um, and they say something inappropriate. And I don't know what all that goes on with your son, but there's some social aspects to things too, where kids with ASD might not understand like that's not cool, um, which is fine. Definitely a conversation topic if they can have that conversation. Um,
Yeah.
but it's hard to explain to other parents too, like when that happens and you're like, hey, he just doesn't understand. Like sometimes they do, sometimes they don't. But I've
Hmm.
had kids that just don't. And then you have to have that conversation and try to teach that. But if there's like understanding receptive language things going on where there's difficulty understanding, it's hard to have that conversation too. Um, so,
I was fortunate. My son is fully aware of what those words mean and how to properly use them.
oh, good.
Yeah, so like I am able to tell him like, "Hey, those are adult words. You're not an adult. You're a
Yeah.
little boy." And then he'll go, "Don't say that." I'm like, "Exactly. We don't say that." You know.
So that's really good that he's able to understand that concept. Um,
Yeah, it saves me a lot of embarrassment at the grocery store.
oh yeah. But you can only imagine there's some kids, there's such a range of delay, depending on, and such a range of deficit with ASD. And you can imagine those kids that are saying these things and they don't have, they're not going to quite understand that talk like adult words. So then that gets tricky for those parents. I can feel for them, like going to the grocery store and they'll just say something to you or someone else, and then they're gonna have to, I feel like those parents feel a need to explain it, and I don't think you should always have to explain your kids' behaviors. Like, no one really knows what's going on in people's lives or what they're dealing with. So um I just wish people would be less judgmental, because they might not know that they're not going to know that kid, they're not going to know what the parents are going through. But um
I used to do the explaining, right? And nowadays I don't. I just go, "Sorry, autism," and like shrug
yeah.
and just keep it pushing. Like they have Google, they can figure it out. I don't need a 15-minute conversation with this person.
And even to
Uh,
have to say that, it's horrible that we have to feel a need to even explain that. And I understand, like, the social constructs of our society, like, kind of lends itself to that, but um I don't think we should have to explain anything. And I find myself doing that all the time, and I keep, like, checking myself, and saying, like, listen, you don't have to tell everyone he has a communication delay. Just let him be who
mhm.
he's gonna be. And I guess if it's like a situation like the bad words and things like that, if he were to do that, maybe it warrants that. But maybe it doesn't.
Yeah, yeah. My biggest problem is like I'm a terrible adult, right? And anytime I hear little kids cursing, it's because it's like the pitch, right? They have this like high pitched little kid
Yeah.
voice, and I cry laughing. It it's one of those things like I think it's so funny, and I'm a terrible influence. So it's a lot to keep yourself in check. And then yeah, and after his speech therapy, he learned how to roast people, and I'm not really sure where that came from, but like I would be on the headset with like one of my friends, and he would grab the microphone, and I don't know if he knew who I was talking to or not, but he would go, "Daddy's pudgy," and then he would run.
Oh my gosh.
And I'm like, "You little monster. I mean, you're not wrong, but rude." And yeah, and so yeah, just when they do start, it's a thing.
Oh yeah. I have, like, plenty of experience with older kids doing that. Um
uh,
I had one kid a while ago, long time ago. Um I was not pregnant, but his mom was. So he's like, "Oh, you have a baby in your belly." I was like, "Okay, no, I don't." So, and he wasn't at the point where he could have that conversation yet. So I was just like, "Uh huh." Just redirect at that point. But I've experienced that so much on the speech therapy side of things, so I can only imagine what it's going to be like. Hopefully, he starts roasting me, because that'll be nice. That'll be
these
nice
kids
to
got
some extent.
these kids have no filter, and like it's really hard too to not treat them like little adults in that moment. Like get down their level, like it's not a baby, it's a cheeseburger, thanks, and like and just like try to have some fun with it. But like if you do that, like it's a bad like sort of like it's not a negative reaction, but it's like a bad influence because now they're going to expect that out of other people, and then they do it to the wrong person. They're like, "Oh, that person hit me. Why?" And you're like, "Well, you can't just run around saying stuff like that to people, my guy."
Yep, then you
Um,
have to have the conversation of body positivity, and you have to feel like positive about yourself. It's difficult, but I don't
right,
know.
and So fortunately for me, like when my son points that out, which if I'm not wearing a shirt, he likes to try to make me do the truffle shuffle, and that's annoying. But like I'm fully aware of my body weight. Like you're a fat guy. Like, all right, I know. Like you're gonna have to get a little more clever than that. I've heard them all. Um,
Right.
uh,
Definitely.
but then like I can't like encourage that. So you're right. Like because like other people they get sensitive about it, and like you don't want to like upset somebody for no reason, and they don't really understand that whole like feeling the room sort of situation
Yeah, I
where
always
like
call it knowing your audience. I have a lot of kids that I work on social skills with. And I was like, we have to know your audience. Like, who are you talking to? How are they going to feel about that? It's putting yourself in people's shoes. Um, and that's tricky. That's like a really tricky concept socially. Um,
hmm
and it's hard to explain and hard to work through. Um, I guess you kind of have to teach the foundation of it, and then in the moment, parents really have to kind of step in and be the one to reinforce that, or a teacher who's in the classroom, because they're going to be more in that situation. But that's a hard concept to teach. Um,
you know I mean I feel like this is a great segue to kind of start getting into some of that and you're right like but I feel like that's like really hard to teach like neurotypical kids too, right? Because I feel like like remembering my childhood and stuff, like sometimes you gotta like test the waters with different people and like you gotta have to like feel that out. It's like almost something you learn by trial by fire, right? So
exactly. But I noticed that the difference is that a lot of um, the pragmatic disorder or social disorder kiddos that
mhm,
I do work with never really get the concept of how to feel that out in the first place. Like, um, sometimes they don't even have they really don't have the foundation to feel that out. Like, as a typically developing child, I think you have the language foundations and the social understanding to an extent. Um, but if you have a pragmatic disorder, I don't even think you have all, and not all the time across the board. I'm really speaking in general terms, but it's hard to speak generally because everybody's so different. But with that thing, as a deficit,
mhm.
yeah, it can definitely be hard to even feel it out to get the experience of it. Um, and the brain learns in different ways too. Um, so it's always a little bit tricky because they might not even find themselves in a social situation to even practice it.
Yeah, yeah, just you know what, especially during COVID, it was really, really hard to set up any of those like early time like play dates, right? Like to kind of get that sort of exposure. And even today people don't really want to come out and like meet up and like have play dates with kids and stuff and it's hard.
Yeah, and um, a lot of a lot of the kids working on the pragmatic stuff, they might not even be at the point where they're able to initiate conversation. Like, they have the words, they're able to talk, but initiating conversation with someone or ending a conversation or knowing how to put in a follow-up question that's going to show somebody you're interested, um, understanding jokes and things like that, like, um, with the pragmatic disorder, they're not even at that point to put themselves in another person's shoes because they're not even getting into the social situation of a conversation and having that typical back to back or back and forth conversation. Sorry.
Mm.
um, so, and yeah, and with COVID and everything, yeah, I think that affected a lot too. Because kids weren't in daycare, they weren't out at social gatherings and toddler events, and when they're really little, setting that foundation. So I think that's contributing to a lot of the delays we're seeing. I guess research has yet to show um, how much that contributed to it, but I don't even know if we'll ever get those numbers. It would be interesting to see.
I can only imagine it had some sort of impact on unintentional social delays and whatnot and making like the first years of school real awkward for some kids.
Yeah. I know kindergartners that had to start virtually, and I think that really affected it differently. I think down the road they're going to have a little bit of a different outlook on life.
Hmm.
But I guess time will tell. It's definitely going to affect the generation.
Right, right. And on the speech therapy side of things, like when you talked about pragmatic disorders and speech delays, like what are some of the like most common things that you experience with kids on the spectrum when it comes to treating speech delays and whatnot?
So I guess it depends on what age group, because I've worked with a huge age range, I guess. I've been with some babies, like they're only like 12 months old, and then I have some young adult clients. So I think the biggest thing in the younger childhood um, times, and then that's even like sometimes before a diagnosis, is that receptive and expressive language delay, um, where they're not saying many words or they're not understanding or answering your questions or making choices. Um, Maybe not responding to their name, which is more of the social piece, but they kind of rope it in with the receptive or understanding of language early on. I think definitely in the early ages, I'm seeing that more. And then with the
Okay.
older kids, I'm working on social language and more complex things like figurative language, idioms, understanding sarcasm, things that I was talking about before with the initiating conversation and having that back and forth and the
Hmm.
follow up questions. But I think there's such a huge range that we can work on. AAC, also augmentative alternative communication, which if a kid is nonverbal, I do try to introduce that early because I've seen so much success with that. Just by adding the visual, a lot of those kids do start talking or at least communicating on the device. But a lot of them do start verbally speaking along with the device, which I encourage. So I see a lot of those things. Um, but it really depends because there's such a broad range of areas that could be affected. So
Okay, so do you see more of like the real young kids that are coming out of like the IU, or are you seeing more of like older kids or maybe even teenagers?
I'm kind of seeing an equal mix. I would say probably leaning towards more of the younger kiddos. Um, Even before IU age, like under 3.
Hmm.
Um, so I would say I'm leaning towards more of that. But I do see older kids with maybe the social language or apraxia and things like that.
What is apraxia for those of us like me who don't know what that is?
Sorry, I just threw a random word at you. If I do that, please stop me.
Oh,
um,
absolutely.
so apraxia is in layman's terms, I guess it would be like a disconnect between the motor planning in the brain and the muscle movement of your articulators, so your tongue, your teeth, your lips, your cheeks, anything that contributes to speech sounds in the oral area and throat area. So it's like a difficulty with programming those motor movements from your brain to the muscles. And some kids with ASD do have that, and it contributes to the nonverbal aspect. Um, it almost makes it impossible to speak. I'm
Oh,
not saying impossible. I think it can definitely be trained with speech motor movements, but um, a lot of those kids, anyone's a good candidate for AAC, like augmentative alternative communication, like the iPads. But those kids are really good candidates for that. Um,
okay.
yeah, because it really it adds that extra layer of difficulty getting the words out. So
So you mentioned like getting trained with training the motor movement. So is this like a series of like exercises then like that you would do to like strengthen the muscles, or
yeah,
is
so
this
they
like
sorry.
no, go ahead. You understood the question.
Yeah, so they used to do just like oral motor exercises that didn't really correlate with speech movements. So basically, now the research lends to doing those oral motor movements, but within the speech context. So doing speech sounds like over and over again, um, a lot of repetition, starting with simple structured words like consonant, vowel, and then vowel consonant. And then you could do like consonant, vowel, consonant, like pop, like the word pop, P-O-P, or cat, like, so you would do like simple structures and go to more complex structures, like if they words have more syllables. But that's how you kind of work on apraxia. But I definitely recommend, especially if it's super severe and it's causing the child to be nonverbal or close to nonverbal or just extremely frustrated. AAC is kind of the way to go with like the iPad apps and speaking
Mhm.
through there. Um, so yeah, but definitely, I know there's like a misconception because they used to do these exercises where you'd stick your tongue out or side to side, and they're learning that like the best way to strengthen it is to keep talking using. So if you say the same word over and over again and do like repetition, like muscle reps, if you're like lifting weights, um, it's kind of like lifting weights. You just keep strengthening that muscle by saying, say you want to say the word pop. You keep practicing the correct positions for the word pop, 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 pop. And eventually it'll strengthen one, the connection to the brain with that. It'll make it a little bit more of an automatic word. But it'll also strengthen those muscles. It more strengthens the connections with apraxia versus the muscle strength. Because there's no weakness with apraxia. It's just more like there's difficulty. um, it's like when you're having a hard time talking to someone on the phone because it's cutting out, like you don't have that connection
Oh, okay,
with.
okay.
Yeah, dysarthria is the one that's the muscle weakness, but that's more of like if there was some type of damage to the brain. So
Oh,
yeah,
wow.
there's a lot
So
that goes into it.
previously when we were talking a little bit about your son and you had mentioned some of like the earlier signs, like he wasn't smiling and like we weren't hitting certain words, and you were looking out for some of these symptoms, like as a speech therapist, what would be some of like the main things that new parents could be watching for in their little ones to maybe get a little bit ahead of the curve and start getting the ball rolling, so they could just be like, oh, I recognize this and this early enough that I can maybe get them before this becomes like a detriment to their lives.
Absolutely. The biggest thing is the not responding to their name, because they're really going to do that at an early age. Once they, that's like a kind of a rite of survival for babies. Like they're going to respond to their name, they're going to turn and look for you. That's the first thing they're going to recognize. So if they're not responding to their name, um, that's a huge red flag. The other thing is not babbling. So if they're really not making a lot of speech sounds at all, so like any consonant like B, D, like ba, da, ga, goo, like any of that stuff, um, and they're not doing it consistently, like if they do it once, because babies are social just like adults, and they're wanting to seek that social connection, and they're going to want to imitate you. So if you're talking to them, they're going to try to babble back to you. So if they're not doing that, definitely say something to your pediatrician. And then by 12 months, if a little bit after 12 months, I would say, I guess by 18 months, but if there was like a combination of things like didn't respond to name, didn't babble, and now at 12 months they're not saying any words at all, and definitely by 18 months, I think that's a huge red flag. I think you could raise concerns at 12 months like I did.
Okay.
um, Especially if it was like in it was combined with those other things.
So if your pediatrician's not on board with your observations, is there like anything that like you can do to get the ball rolling on your own without their referral, or do you have just to keep bouncing to pediatricians until you find someone who's like, here, let me help you out?
I mean, my pediatrician really didn't fight me on it once I was like firm about it. But if you find a pediatrician that's extremely against it after you've been firm about it, I would bounce to another pediatrician, but you definitely need a referral. I guess you could call Birth to 3, Lehigh County Early Intervention. That's who does it before 3 years old. I guess you could call them and they may be able to help you out with resources. I didn't have to get to that point. But I wonder if you were really concerned, you could call them and have them help advocate for you.
Mhm.
I would hope so. And if I ever get a chance, I can ask my speech therapist through there. She was here today. I should have asked her that. Um, but if I do, maybe you could update it in the description of the podcast. That way people could know if that's a resource they could use. But it shouldn't be too hard to find a pediatrician who will actually refer you. I think you just have to be firm and really advocate for yourself and not being mean or anything. Just say, hey, it doesn't hurt. It's free. I'm just concerned. I want this peace of mind. If they don't qualify, they don't qualify. It's not a big deal. I just want the evaluation to see where they're at. Um, you could always try outpatient too. Like I always have openings. So if they really fight you on it and you can't get that referral, there's some speech therapists like me who do like affordable private pay things. I try to make it a little bit affordable. That's how I started. I do accept insurance now, but I still have like this private pay for people who don't have the insurances that I have, to try and keep it like low so that people can at least get an evaluation and figure out if it's worth pursuing speech therapy. Um, so you could always seek out like someone private to do the evaluation and then go to your pediatrician and say, hey, their evaluation said this. I really need that referral now for early intervention. But I guess that's a last resort. I think they should be able to get you to early intervention first. And that would be the first step I'd recommend before going private, because it's free and they come right to your house. So it's super convenient. And they teach you, it's really parent led. So they teach you everything you need to know to carry out and generalize what they're doing. So that would be the first step. But you could always
Okay.
get that evaluation and as proof if you need it too. But
Okay. So, let's say we've got our referrals, we've gone through the process, we've gotten a speech therapist. What is like the average session look like for a kid? Because I know like sometimes parents don't always stay around for the sessions. Sometimes they do, you go to houses, sometimes they come to you. It's like what is like the average session look like for you?
so for the little kiddos, it's really play based. It's gonna look like we're playing with those kids. Um, we have we have some method to our madness, so to speak. But I've had parents go, hey, you're just playing with them. What are you doing? But I tend to explain what I'm doing while I'm having the session. It's nice to have the parents there, actually. But I will do a lot of modeling, starting with simple core words, depending on where they're at, I guess. If they're completely nonverbal, I'm going to start with these simple core words, which are words that are high frequency words that we use in the English language, um, and that are really essential for requesting things like more, eat, drink, open, go, on, off, in, out. Um, you can look up a core word list. If you look up Touch Chat, they actually do have all those core words on their core word page. Touch Chat is just an AAC app, but they have all the core words that are really high frequency. So, but we'll incorporate those words into sessions a lot. Um, and doing play and maybe jumping in with them when they're eating snack and just working on functional communication. That's the first step. Um, as they get older, it may look a little more structured. Um, I always lean, and it really depends on the speech therapist you have. I always lean towards more functional, less structured, because the kids have a more like a fun time and they really don't, it's like tricking them into speech. So like you're doing speech therapy with them, but you're not doing work per se.
Mhm.
So then they're more open to receiving what you're teaching them, and it really helps with generalizing it and carrying it over out into the real world. Um, but there's some speech therapists who like their structured sessions, and that's okay too. Um, Honestly, some kids work better with the structure, some kids don't, and finding the speech therapist that works with your kid um, is pretty essential. Like finding the right fit, I guess. But definitely with the earlier ages, it's going to be a lot of play. It's going to look like we're just playing on the floor. And if we don't explain what we're doing, it just really doesn't look like much, but it's setting the foundation for things.
Okay, and then, like, so say a parent sits in on one of those sessions and they go home and maybe they kind of, like, mimic, what you were doing in that session, like, is that something you encourage, or would you rather parents kinda, like, leave it to the professionals?
No, they definitely should incorporate some things that they're seeing. Speech therapists should be having those conversations with the families, especially with the younger kids. I understand this. I worked in the schools for a while, and we don't always get to have a lot of conversations with parents. Unfortunately, I think it's just the nature of the academic speech therapy. I feel like in outpatient and private practice, we have a little bit more hands on connection, and early intervention under 3. They have more hands on with the parents, able to speak with them a little bit more personally. But if you're able to carry over what you're seeing in speech therapy, it's a really good thing. And I always tell parents, don't it may not come natural at first, with the way we model language, um, expanding utterances. So if they say just go to the park, like adding on and exposing them to more language, um, it might not seem supernatural at first. So I always tell them to pick a couple of activities or times of the day where they're going to do this. Instead, I know it's unrealistic to do all of the time at first until you get used to it. Um, but just really talking to your child and narrating and labeling things, and just talking a lot more than you think you want to talk. Like you're gonna feel like Miss Rachel. For those parents who know who Miss Rachel is on YouTube, you're gonna feel like Miss Rachel, and that's how I want you to feel.
Alright, awesome. It's been really cool talking about, like, the speech therapy side of things, and I feel like we've really, elucidated on a lot of stuff that I can only imagine parents who are kind of just approaching that, a lot of those questions that they're really worried about there, and I kinda wanna progress, into talking a little bit more about you on a personal level, um, because a lot of us and it's like a reiterating theme of the first season of the show here when we first start experiencing these delays and these various symptoms within our kids. It's oftentimes like really scary. We feel alone. Some of us get depressed. um, well, there's a lot of guilt sometimes too when you just like you realize like you've been doing things a certain way that's just not working and you're not understanding that, and like and then refiguring out your kids. So, I kind of wanted to kind of get into it with you a little bit and really give you an opportunity here to kind of like express what it's like for you as a parent and the things that you're feeling, because I'm sure there's a lot of listeners out there right now who uh, would love to connect on that sort of level, even if like you never talk to them individually, but they like know other people are out there and kind of validates. You know what I mean?
Yeah. Um, it's been rough. I think I'm at a point of accepting whatever happens, and I love him exactly the way he is,
Hmm.
no matter what, like I always have. Um, but for a while there, I feel like you really do kind of go through the stages of grief, and to put it in perspective, if he does get a diagnosis, I feel like he'll be at a level 1. He'll need not as much support as some kids do, and I still feel like I went through the stages of grief. But maybe sometimes I feel like, he's at a point where he won't need a lot of support, and I feel guilty for feeling those stages of grief, because I think I know what other parents have gone through. I've seen it firsthand. I've worked with kids. So I think in that sense, I feel guilty, um, because he doesn't have, he doesn't have any cognitive delays. Um, he understands relatively a lot. He has a decent amount of words. So sometimes I grapple with that a little bit. Um, Definitely when
Mhm.
he was younger, I was very anxious, um, knowing those milestones and when he was supposed to hit them, and then he wasn't. And then a month goes by, and another month goes by, um, and he still doesn't hit those milestones. I definitely felt a lot of anxiety, frustration, a little bit helpless. Like I knew which steps to take, but he was too young before 12 months to even take any steps. So now I'm just anticipating the steps I have to take. And you have everyone in your ear, like, and like everyone means well. Like my parents, my husband, oh, he'll be fine. He's okay. He'll be fine. And like in my gut, I'm like, but it doesn't really hurt to get this stuff done. Like it doesn't hurt. He needs to, you just kind of feel helpless because at that point there really was nothing to do. Um,
Yeah.
and a huge thing, um, I wasn't diagnosed, but I'm looking back, I'm 100% sure, or maybe 99% sure, that I had some postpartum anxiety and maybe depression. I wasn't depressed, but I definitely was anxious.
Mhm.
Um, and I feel like sometimes I look back and I'm wondering if I could have interacted with him more, because sometimes I was just completely overwhelmed and didn't interact with him as much as I should have. Um, and I know that's probably not true because I did a lot for him, but I always felt like I wasn't doing enough. So I think I'm over that now. I don't feel that way anymore about where I'm at with him. Um, and looking back, I can't tell you whether I was doing enough or not. Everyone else around me was saying I was doing enough. So, um, but I like kind of felt like I was failing him a little bit back then, and maybe I should have reached out and like we were in therapy, which was good, but it wasn't necessary. I don't even think I brought that up
Mm.
in therapy. So, but I definitely would recommend anyone going through that thinking they're not doing enough to go to therapy. Um, in the moment, it probably would have been a good decision to talk about it. Because I think I struggle now wondering if I did enough back then or not.
Yeah, I think like all parents on some level kind of struggle with that, right? Like, am I doing enough for my kids? But especially us autism parents, because we don't have like our kids don't have that uh ability and methodology to really communicate with us the things we're doing for them are understood and acknowledged. And yeah, I can really relate to you there. Like, trying to do things for my kid and really just feeling like, just exhausted and tired all the time, and then feeling guilty that I was exhausted because he still needed things and I didn't know if he was getting all that he needed. It's really, really hard to kind of go through those stages, and then like to come to terms with that because we have our kids, and I don't think anybody who's getting an autism diagnosis out there is like, yeah, I got one, you know. So like learning how to work through that and really like coming to terms with emotions and dealing with that like sort of guilt and depression is really, really hard on a lot of us. And it's a big reason why I like touching on it in this section of the show, because man, when you're sitting there at those kids and you're just overwhelmed yourself, and it's hard, and you feel very alone. And then like you said with the surrounding people, uh who are like, they want to be your support system, but they're clueless, right? Because they haven't been through it, and you're right, they're basically a bunch of talking heads at some point, and they're like, well, this, and it's like, I understand that you're trying to make me feel better, but right now it's not giving me what I need. And then like the focus gets redirected towards the kids, and sometimes it feels like, as a human being, like you're kind of being forgotten. So yeah, it's tough sometimes, right?
Yeah. And I think the worst part is there's such a stigma around autism. And I think I don't feed into that, but I'm worried about what other people will feed into, like, will think.
Hmm.
Um, and not like, I just want him to have all the opportunities. Um, and I just saw a story where someone who was diagnosed with autism wanted to join the Coast Guard, and he's high functioning, and I know that's like not a term that anyone uses anymore. That's not a great term to use. But I guess that's what he was diagnosed with a long time ago, back in the day. But he wanted to join the Coast Guard, and they wouldn't let him join the Coast Guard because he had an autism diagnosis.
Yeah.
But he was fine. There were just, some little things. He really didn't. There was nothing that would have prevented him from joining the Coast Guard other than having the diagnosis that he got a long time ago.
Yeah.
Um,
Yeah.
so
That's
that, I think that gives me anxiety and it gives me fear. Like, I want him to have every single opportunity as much as anyone else. And I think he's gonna we have the evaluation in November. I think he's gonna get a diagnosis. Um, if I had to, like, as a speech therapist, unbiased, I can't give the diagnosis, but seeing it, he's gonna get one, like, most likely.
yeah.
And it just gives me this, like, anxiety and fear for, like, not having the opportunities that everyone else has, even, you know
Hmm. Hmm. Hmm.
I think that's the worst part.
Yeah. Yeah. Because as a parent, that's all you want to see, right? Is your kid grow up and flourish. And yeah, that is rough. I mean, if it gives you, like, personally, any sort of like hope or anything, uh, like, my very first episode that I did, I sat down with Gary, and his daughter. I believe she was 9 when she started speaking, and now she's 18, and I believe headed to college. Um, I had another guest on. I don't know if that episode's out yet or not. It might not be. But their kid wasn't even potty trained until he was like 13 or 14, and now he's working a job. So there is that sort of like, um hope out there that, like, even though we have these delays, that bare minimum they'll at least be able to enjoy life, right? And like, from my personal experience, because my son is only he's going to be 7, he's in first grade, and society and public schools, for all of their shortcomings, I feel like they've made leaps and bounds, in the social field of like acceptance. And my son has never communicated that he's been bullied. I've never had any reports from teachers of like kids picking on him. When I take him to playgrounds and stuff, sometimes the kids are like confused at first, but when they find out that he has autism, it's usually like this moment of realization, and then they're like real accepting. So I feel like, it's not like when we were kids where, you would have just been bullied mercilessly. um, I feel like society's really made improvements when it comes to, at bare minimum, accepting and helping these kids out.
Yeah. And I do agree, because I do see that a lot with my clients firsthand, that they're almost more popular actually than anything. Like, they went to kindergarten, and they're more popular than I guess the parents were so worried about them getting bullied, and they were just super popular and everyone loved them. Um, so I do see that firsthand, but there are still some limitations. And I guess that's almost with everything. Um, but it just gives me a little anxiety, and I think I'm going to hold on to that forever because I'm worried about him and I love him,
Mm-hmm.
and I just want him to be successful and happy, and probably in the opposite order, happy and successful. But um, you know, I
Yeah.
guess I have to cross that bridge when I come to it, and I just kind of got to learn to let go a little bit and like live in the moment more because I'm a planner. So
Same.
I like to live in the future. um, so I have to kind of ground myself sometimes, but I'm definitely in a better place than I used to be about it. Um, After he gets the diagnosis, you'd probably have to talk to me then because I might feel a different way. It's definitely a roller coaster.
Yeah, yeah, it is. It's real hard. And like when you get that diagnosis, there's just like a little bit of moment of relief, right? Because once you have that piece of paper, then you can really start pursuing some of the stuff that they need. And it alleviates a little bit of that. But I'll tell you, to this day, there are times like with a lot of stuff you just mentioned where I cry for my son, you know, just grown man tears cry for this little boy once in a while, just because like you said, the anxiety and just all those wants that you have for them, because you love them so much, and you just want to see them happy. So it's hard. Um,
And the world's hard enough, then you add an
oh,
extra layer.
how about it? How about it? Uh, Yeah, I mean, so we kind of like touched down on that, and it's nice because it's like a very real, very human thing to talk about. And I feel like a lot of times, us as parents, nobody really asks us how we're doing. Nobody really asks us how, like, hey, you're out here struggling so hard, and I see you, like I see what you're going through. And it's tough when nobody asks you, like, "Hey, how are you? Like, tell me exactly how you're feeling, and I'm not gonna judge you." Because, like, I feel like a lot of times, like, especially for me, like, other parents, I feel like they judge me for having those feelings, right? Unfortunately, during the recording of this episode, at this point, we had a software failure, and our guest was unable to continue recording as for some reason Zencaster just stopped recording her. We still would like to thank her for being a part of this episode and continuing this project that I hope brings awareness and advocacy to all of our children on the spectrum and helps bring a feeling of mental and emotional community to the rest of us parents out here who have the honor of raising them. Thank you for tuning in to the Brighter Spectrum podcast. If you have any comments, questions, or stories to share, or if you'd like to be a guest on the show, feel free to reach out to me at brighterspectrumpodcast@gmail.com. I'd love to hear from you. Until next time, take care and keep shining a light on the journey of parenting.
Thank you for listening.